Vitamin B12, also known as cobalamin, is a water-soluble vitamin crucial for various bodily functions, including red blood cell formation, nerve function, and DNA synthesis. Unlike some other vitamins, the human body cannot produce vitamin B12 on its own, necessitating its intake through dietary sources or supplements. Despite being essential, vitamin B12 is often misunderstood, and deficiencies are more common than many realize, affecting not only vegans and vegetarians but also a significant portion of the general population. This comprehensive guide delves into the importance of vitamin B12, the risks and causes of deficiencies, and the role of supplementation. Vitamin B12 is indispensable for several critical biological processes. It is essential for the production and maturation of red blood cells, working in conjunction with folate vitamin B9 to form healthy red blood cells. A deficiency in B12 can lead to megaloblastic anemia, characterized by the production of abnormally large and dysfunctional red blood cells. In terms of nerve function, B12 is crucial for maintaining the myelin sheath, a protective layer around nerves that facilitates efficient transmission of electrical signals. Deficiency can lead to neurological issues, including numbness, tingling, and even severe neurological damage if left untreated. Vitamin B12 is also involved in DNA synthesis and repair. It acts as a cofactor for the enzyme methionine synthase, which is critical in the conversion of homocysteine to methionine, a building block for proteins and other important molecules. Although not directly involved in energy production, B12 plays a role in converting food into glucose, which is used as a source of energy by the body. Vitamin B12 is naturally found in animal products. Some of the richest sources include meat, with liver and kidneys being particularly high in B12. Other meats, such as beef, lamb, and poultry, are also good sources. Fish such as salmon, trout, tuna, and haddock are excellent sources of B12. Dairy products, including milk, cheese, and yogurt, contain B12, as do eggs, particularly the yolks. For those who follow plant-based diets, fortified foods can provide necessary B12. Some plant-based foods, such as cereals, nutritional yeast, and plant-based milk alternatives, are fortified with B12 to help vegans and vegetarians meet their nutritional needs. Despite the availability of B12-rich foods, deficiencies can occur due to several factors. Dietary restrictions, such as veganism and vegetarianism, increase the risk of B12 deficiency because plant-based diets typically lack adequate B12. Fortified foods and supplements are essential for these populations. As people age, the ability to absorb vitamin B12 decreases. Older adults often have reduced stomach acid production, which is necessary for B12 absorption from food. This makes B12 deficiency more common in the elderly. Certain gastrointestinal disorders, including Crohn's disease, celiac disease, and atrophic gastritis, can interfere with the absorption of B12. These conditions damage the lining of the stomach or intestines, where B12 absorption occurs. Surgical procedures, particularly gastric bypass surgery and other weight loss surgeries, can reduce the stomach's capacity to release B12 from food. Patients who have undergone these procedures are often advised to take B12 supplements. Certain medications can interfere with B12 absorption. Long-term use of proton pump inhibitors PPIs, histamine blockers, and metformin can lead to a deficiency. Intrinsic factor deficiency, seen in pernicious anemia, is another risk factor. This autoimmune condition prevents the body from producing enough intrinsic factor, a protein necessary for B12 absorption. This condition requires lifelong B12 supplementation. The symptoms of B12 deficiency can be subtle and often develop gradually. They include fatigue and weakness due to anemia, resulting in shortness of breath. Neurological issues, such as numbness, tingling in the hands and feet, difficulty walking, memory loss, and cognitive decline, are also common. Psychological symptoms, including depression, irritability, and mood swings, can be associated with low B12 levels. Gastrointestinal problems, such as a swollen, inflamed tongue, mouth ulcers, and digestive issues like constipation or diarrhea, may also occur. Long-term deficiency can lead to severe and potentially irreversible damage, especially to the nervous system. Early detection and treatment are crucial. Regular blood tests are essential for monitoring B12 levels, particularly in high-risk groups. The standard tests include the serum vitamin B12 test, which measures the amount of B12 in the blood. Levels below 200 pg/ml are typically considered deficient. The methylmalonic acid MMA test measures MMA levels in the blood or urine, which can indicate B12 deficiency, as MMA accumulates when B12 is insufficient. The homocysteine test measures homocysteine levels, which can also suggest B12 deficiency, as B12 is required to convert homocysteine to methionine. For accurate diagnosis, healthcare providers often consider symptoms, risk factors, and a combination of test results. Vitamin B12 supplements are available in various forms. Oral supplements come as tablets, capsules, and sublingual under-the-tongue preparations, effective for most people with mild to moderate deficiency. Intramuscular B12 injections are used for severe deficiencies or when absorption issues are present, providing a direct route for B12 to enter the bloodstream, bypassing the digestive system. Nasal sprays and gels are absorbed through the nasal mucosa and can be an alternative for those who have difficulty with oral supplements or injections. Fortified foods are a useful option for individuals with dietary restrictions, helping them meet daily B12 requirements. The recommended daily intake of vitamin B12 varies by age, gender, and life stage. For adults, the recommended dietary allowance (RDA) is approximately 2.4 micrograms per day. Pregnant and breastfeeding women require higher amounts. Vegetarians and vegans should consider regular B12 supplementation or consuming B12 fortified foods to prevent deficiency. Due to decreased absorption with age, older adults may benefit from B12 supplements, even if they consume animal products. Individuals with gastrointestinal disorders or who have undergone certain surgeries may require higher doses or injectable forms of B12. Those on long-term PPIs, histamine blockers, or metformin should have their B12 levels monitored regularly and consider supplementation. Vitamin B12 is a critical nutrient that supports essential bodily functions, including red blood cell formation, nerve function, and DNA synthesis. Deficiency can lead to a range of health issues, from anemia and fatigue to severe neurological damage. While vegans and vegetarians are at higher risk, B12 deficiency can affect anyone, particularly older adults, individuals with certain medical conditions, and those on specific medications. Regular monitoring of B12 levels through blood tests is crucial for early detection and treatment of deficiencies. Supplementation, whether through oral supplements, injections, or fortified foods, plays a vital role in maintaining adequate B12 levels and preventing deficiency-related health problems. Understanding the importance of vitamin B12 and recognizing the signs of deficiency can help individuals take proactive steps to ensure they meet their nutritional needs, thereby supporting overall health and well-being. Thank you for watching. If you found this information helpful, don't forget to like, share, and subscribe to our channel for more health tips and insights. And remember, your health is your wealth, so take charge of it today. See you in the next video.